Hello, everyone, and good afternoon. I see we've got a few more people still joining, so I'm just going to give it another 30 seconds before I start. But whilst I do, I just wanted to say hello to everyone and thank you for joining us on this, well, at least where I am, particularly chilly November afternoon. But really excited to have you here joining us today for our webinar on the infopool. So for those of you who don't know me, my name is David James. I'm the Director of Patient Projects and Prostate Cancer Research. And we're going to be talking about the infopool today and our sort of journey in terms of the process of actually really why we made it, how it's been developed to support and empower people affected by prostate cancer. We'll hear from Tony later, who is going to tell you about his experience of his disease and also how he's found the infopool. And then we'll have some time as well at the end for questions as well. So I'd like to begin by telling you about a remarkable individual named Dee. So Dee is 63 years young. He originally hails from Guyana in South America. And his life's journey is really quite an extraordinary one. It's marked by resilience, strength, and that profound human experience which we all share. So in his youth, Dee pursued quite an unexpected passion, right? He loved ballet. He dreamed of becoming a professional dancer. Unfortunately, the twists and turns of life got in his way, but he ended up working in London's bustling financial district, where he shone shoes, made connections, and left an incredibly warm impression on those he met. Now, my own impression of Dee is a wonderful one. He is a lovely, kind, caring man who I've had the pleasure of getting to know over the last 2 years. Sadly, in December 2015, Dee was diagnosed with prostate cancer. Now, this news came as nothing short of a severe shock for Dee. Suddenly, his future was uncertain. He was thrust into a world where he knew very little about. And the healthcare professionals he encountered seemed to forget that Dee wasn't just another number on a piece of paper, but that this was a real human being sitting before them. So he had questions, rightly, he had concerns, and he sought the empathy and understanding. But his experience with his healthcare professionals left quite a lot to be desired. He felt rushed into making a decision about his treatment. And unfortunately, the lack of information that he had led him down a path that he said he wouldn't have chosen if he had known otherwise. If he had known now, if he knew now if he knew then, I'm sorry, what he knows now. So in March 2016, Dee underwent a non-nerve sparing radical prostatectomy surgery. And years later, he's still grappling with the consequences. And whilst thankfully he says he is over the depression that came with that, the persistent effects of incontinence and erectile dysfunction still haunt him, and his feeling of being a whole man, his sense of self. Unfortunately, Dee's story is not unique. So our research back in 2020 and 2021, it uncovered several critical gaps in the care and understanding of prostate cancer. And these gaps not only lead to poorer outcomes, but they also actually erode trust in our healthcare system. So the first problem was a lack of medical understanding. One of the most pressing issues that we uncovered was there was a lack of medical understanding as to why prostate cancer affects some communities more than others, particularly how it disproportionately affects Black men. So Black men are 2 times more likely to be diagnosed than white men. They're also more likely to receive their diagnosis at a later stage of the disease, and also more than 2 times as likely to die of the disease than white men. The second problem was a lack of data. See, the efforts of researchers around the world are being hindered by the scarcity of joined up data. And that means when this data isn't joined up and talking to each other, new diagnostics and new treatments might not work as effectively because we don't have the full picture of the impact of this disease. And so this lack of data can also erode trust, because we then know that some treatments might not work so well in some people than others, because the data isn't there to support that. The third problem was a lack of accessible information. We saw that there was a significant deficiency in terms of accessible information around treatment options and also clinical trials. We know that nearly half of the population suffers from what is called low health literacy. And really what that means is that health information, which is, it doesn't have to be, but it typically is quite complicated. It involves scientific words and jargon and numbers and statistics that many people struggle to understand and take that information that often that they're given without real support from healthcare professionals. And then how do they synthesize that information? How do they take that and then turn that into something actionable? How do they make decisions based on all this complicated information? And when you combine that with the fact that the prostate cancer treatment options, there are quite a lot of them, depending on when you're diagnosed. If you're diagnosed earlier, you might have 4 or 5 treatment options that you have to make a decision about with your healthcare team. How are you supposed to do that? You're not a healthcare professional. Suddenly you're expected to gather all this information and make a decision about your treatment. It's a very challenging situation, and we knew that people have a variety of informational needs, and those weren't being catered to. The fourth problem was a lack of social interventions. We know there's a shortage of really effective interventions that have been proven to work. These interventions often don't involve men with lived experience of the disease in helping develop them. So they're often not really targeted at the right people in the right place at the right time. And so as a result, they can fail to empower the very people they seek to support. And so what I'd like to do now is tell you about the solution we developed, which, as most of you know, given the title of this, it was the infopool. So in our quest to build a solution which worked for everyone who's been affected by prostate cancer, we embarked on a journey to gather a range of insights and perspectives from a variety of stakeholders. We knew that if we were going to develop a comprehensive and effective solution, we needed to take a very evidence-based approach. So we aimed to look at what worked well and what is working well and what was working less well. And then this approach guided us. So we then built out patient advisory boards and clinical advisory boards. And these 2 groups were key in co-developing a solution that was not only medically sound, but also sensitive, effective, and appropriate. And what we learned from speaking with real people affected by this disease is they wanted to hear from others who shared their experiences, who understood their unique challenges. People wanted to learn from others who looked like them, who maybe walked a similar path. And so we set out to build something that would answer that call. And of course, to bring our vision to life, we needed funding. And we were very fortunate to secure some support from the National Lottery Community Fund to kick things off. And so with this funding in place, we began to turn our process of turning our vision into a reality, right? So, and this was what we call an agile delivery process. So we would test something, and then we would build it, and we would test it again and tweak it. And this constant sort of feedback loop to make sure what we were developing was as effective as possible for the populations we were seeking to support with this project. And that is how the infopool came to be. And so now I'd like to just play a quick 2-minute little animation. And I apologize if any of you have seen this already, but if not, hopefully this really shows you what the infopool is all about.
Meet Bob, David and Raj. Bob has recently been diagnosed with prostate cancer. The doctor talked to Bob about his treatment choices, but he has forgotten the details. Bob is unsure what treatment choices are available to him. This is where the infopool comes in. Bob enters some information about himself. He is shown some treatment choices. He uses the comparison tool to help him compare treatments. Next, Bob chooses which treatment he wants to learn more about. Finally, Bob discovers other people's stories. This helps him consider which treatment might be best for him. Now, back to David. His doctor just told him that his PSA was raised. His doctor has referred him to hospital for more tests. David is worried. He wants to understand what tests he might have. He came to the right place. The infopool can help. David can learn about the different tests and scans he may have. This helps put his mind at ease. And then there is Raj. Raj was diagnosed with advanced prostate cancer. He's wondering if he's eligible for any clinical trials. Raj is in a difficult situation. Finding the right clinical trial is not easy, but it is much easier with the infopool's clinical trial finder. Bob, David, and Raj. With the help of the infopool, they feel more prepared and informed. Find out more, and when you are ready, come share your story on the infopool.
So hopefully most of you are aware of the infopool, but it's a really, we think, a groundbreaking initiative that has emerged from the collective efforts of patients, really truly hundreds of patients who've contributed their invaluable time and support and stories to the site. And we think the infopool is really quite unique because, well, actually, there are a number of reasons why. One is it is culturally representative. It addresses some of the unmet needs and the historical lack of resources that have been out there for underserved communities, particularly the Black community in the UK. It's been tailored to address individuals with varying levels of health literacy. So it uses videos, animations, infographics, illustrations, and clear, easy to understand, simple language in what we call lay terminology, so that is appropriate for people of all, as I said, health literacy levels. It offers a wealth of information across a number of different and really critical areas, from testing and diagnosis early on to treatment options through a comparison table that allows people to compare different treatment options side by side, that was developed with our patient advisory board and has kind of top-level summaries of different types of treatment. There's information around navigating life with side effects, whether patient stories integrated in that. There's that clinical trial finder, which we almost saw all of in the video, and recently also a partners section that we developed, and a local services tool as well, and allows people to look for different support services and treatment in their local areas. So it has this kind of wealth of information, but it's also developed in a way that's really sort of simple and guided, and helps people kind of find the information they need in a really stepwise process. We've also continued to kind of grow it. As I mentioned, I talked about the partners and carers section that we launched recently, and back in September, we launched a new section for partners and carers, but we're also continuing to develop it. So we're developing new toolkits, which we hope to launch in early next year, thinking around patient rights, shared decision-making, more information around clinical trials, and then actually how to get the best out of your meetings with your healthcare team. I think one of the things, and I know Tony's going to touch on this later, but the power of those stories, real stories from real people, patients and partners, and how impactful that is. And that these are filterable by things like age, ethnicity, sexual orientation, etc. So you can find stories and experiences that hopefully you can relate to. Of course, it's not only patient-centered, but it's evidence-based, and it's always kept up to date. And that's thanks to the collaboration we have with leading clinicians and our team, who's constantly making sure the information on there is kept up to date and is clinically valid. But I think finally, and most importantly, is that patients from all walks of life played a pivotal role in co-developing this resource, ensuring that it is simple, easy to understand, and directly addresses the needs of those who it seeks to support. And I think the infopool really, to us, is a testament to what can be achieved when we listen and when we collaborate and ultimately strive to make a difference. And we're really proud to have the endorsement of the largest urological nursing association in the country, BOUN, the British Association of Urological Nurses. And we see that really as a testament to the invaluable role this site has already got in supporting patients and healthcare professionals alike. We're also really pleased to have received accreditation from the Patient Information Forum, which is what they call PIF-TIC accreditation. And that just underlines the commitment to providing high quality, trustworthy information on the infopool. But we know that, as I mentioned, we're talking about Bourne, but actually healthcare professionals of all sorts and stripes. We have urologists, oncologists, nurse specialists, and other healthcare professionals who have told us how they found this to be a really valuable resource to supporting patients and how they're using it to support their patients. I'm not going to read through these, but we have a variety of different kind of quotes from different healthcare professionals from across the country in different parts of the healthcare journey, just really sort of emphasizing how beneficial they've found the infopool in their practice. And this next slide just really shows actually some of the signposting materials we have. So when we're going out and we have a team, and I'll talk more about what they're doing, but part of our outreach work is going out and talking to healthcare professionals, making them aware of the infopool. Because actually, that's one of the biggest challenges we have, is making sure that there are healthcare professionals out there who know that this resource exists, and then how they can use it to support their patients. And so once we've made that contact and connection and demonstrated the site, and they've verified that it's rigorous and properly made, and it's got all the right information on, they obviously want to do their due diligence before they signpost patients to a resource and a new resource. We then send them out these packs of information. So you'll see here we've got kind of the 3 posters up top, which hopefully you guys might have seen in some clinics around the country. And then we also have these little business cards and flyers. And so these are things that they can then integrate and put into their information packs that they give out to signpost patients to the infopool. And then we also send them digital links and other things that can be included in clinic letters and other ways. So we look to sort of work and tailor the information as well to support them to integrate it into their practice as best as we can. Now, kind of back to patients for a moment, and I want to tell you the story about Robert up from Inverness in Scotland, who I think exemplifies the profound impact that the infopool is making in the lives of individuals who are battling prostate cancer. So Robert's journey, I think, is testament to the power of sharing information, stories, and support. So Robert was guided to the infopool by his consultant nurse, who we'd reached through that work I was just talking to you about. And Robert found a wealth of resources and personal stories that he told me have been instrumental in his own struggle with prostate cancer. And at the time, as he was preparing to embark on a course of radiotherapy, he said that the infopool had been a source of mental and emotional support. The fact is that it provided him with real-life accounts from people who'd walked a similar path. And I think what makes Robert's story, even more remarkable is his commitment to giving back. So he says that when he's finished his radiotherapy and had time to kind of reflect back on it, that he intends to come back to the infopool and share his own experience in the hope that it can provide some sort of solace, guidance, and inspiration to other men who may face similar challenges to him. And I think that's kind of really important as well to us, is the infopool is creating this sense of community as well, as people understand the importance of sharing their experience and the power of that unique individual experience, and how valuable that knowledge and sharing that and paying that knowledge forwards is to others who are going through similar journeys. And this is just some of the highlights of some of the different testimonials we've had on the site. We've been incredibly sort of truthfully actually overwhelmed with the positive feedback we've had with the site. And one that's always sort of really stuck with me is a gentleman who wrote in and said, he doesn't think there's anything quite like the infopool out there, and how it helps put his mind at ease, however daunting things may seem. I thought that was really important. We know how daunting and truly terrifying a diagnosis and treatment can be, and so that we're able to sort of support in that way is really important to us. And so since its launch 8 months ago, I think we've really been on a mission to reach as many men as possible, but actually not just men, also partners and carers as well. And I think this is evident in the workshops that we've been conducting right across the UK. So we've had 15 workshops that my colleague Harriet been attending and delivering workshops, and also working with partner organisations to deliver these workshops about the infopool. And this is part of us trying to sort of spread the message about the infopool, get that information out there so people know about it at the time they need it, and not just reaching through healthcare professionals, but also just directly working in the community as well. And the feedback from these workshops has been really overwhelmingly positive. We've had 95% saying they were completely satisfied with the information and support they received from the site. We're also really proud of the fact that we've got over 40% of hospitals in the UK are already signposting to the infopool, 104 as it stands, but we actually had colleagues up at the British Association of Urological Nursing conference this week. We've had a lot of interest from other nurses as well, so expect that number to actually jump probably by another 20 or so in the next week or so. So we're just continuing to be blown away by the fact that the site is receiving that trust and recognition from the medical community, and we just want to keep working to deliver that and keep it as useful to healthcare professionals and patients and partners as possible. We've also been really pleased with the feedback we've got directly from users of the site. We've had an impressive 86% satisfaction rating from over 1,200 individuals who've shared their thoughts and experiences on the site. Obviously, it's not 100%, so that still leaves room to grow, and we're always mindful of that, and we continue to want to make this as good as we can. Nearly 900 people have contributed their stories to the site, which is just mind-blowing. That's just incredible. So many people out there who've done that. Maybe some of you on the webinar today, and just really, that's what makes us so unique, is this incredible support from the community for people who've been affected by this disease and contributing. And then the number of people also who've come and visited the site in these 8 months, over 60,000. And we understand that remains not everyone who's affected by prostate cancer, and we just want to continue to grow that. And with your kind support and help, we hope to be able to reach as many people as possible affected by this disease. So you've probably heard enough from me for the moment. So it's now my pleasure to introduce you to Tony. So Tony, if you'd like to pop your video on. There you are. Hi, Tony. I'm going to hand over to you to talk and give people a break from me.
Hi, David, and thank you for that. So I'm Tony Ker. I was diagnosed with advanced stage prostate cancer in May 2017. I was actually training for one of the world's toughest ultramarathons at the time and had what I thought was a runner's groin strain. I went to see a sports injuries doctor, which is really a bizarre way to get diagnosed with prostate cancer. But the MRI scan that the guy did showed up there was something untoward, and further investigation led to the conclusion it was advanced stage prostate cancer. It spread into virtually every bone in my body from pelvis to skull, and I was given a worst case prognosis of 2 years. And as you can imagine, that was a real shock. I soon discovered that turning to Dr. Google was a really, really bad idea. And I have to say that I struggled mentally really badly for the first 18 months or so after I was diagnosed. I thought way too much about dying, so much so that I actually forgot the joy of living. And I was desperate to talk to other people who were going through what I was going through, had been through what I was going through, but I simply didn't know where to look. And back then, this was 6.5 years ago, thankfully, I've responded really well to treatment, and my PSA, that was 129 back then, is now fallen to undetectable, where it stayed for over 5.5 years. But back then, information was pretty much confined to, here's a load of booklets, go and read them. And even the online information, if you excluded Dr. Google, was limited to downloadable booklets and brochures. It wasn't easy to navigate. And eventually, I just didn't know where to turn. So I contacted a charity and asked if they knew of any runners with a similar diagnosis, because I was really interested to try to find out what the impact had been on other runners of a stage 4 diagnosis and long-term hormone treatment, which I was scheduled to go on, and I'm still on to this day. And I was actually introduced to a guy called Kevin Webber. I'm sure some of you will know of Kevin. And Kevin really inspired me to live a better life with cancer, and to carry on doing things that filled me with joy. And I've tried ever since to do that. I was then approached by David and his team at Infopool to provide patient input to the development of the tool. And so I can say hand on heart, it was actually shaped by patients for patients, which I think is wonderful. It's great to see patient involvement in the development of such an important tool. I think it's actually a really invaluable tool, particularly for the newly diagnosed, but also for those further down the line who experience cancer progression or treatment failure, because you can go back to the Infopool and research the treatment options that might be available. For example, if you become castrate resistant instead of castrate sensitive. But for me, the most important part of it was about connecting to other patients by being able to access their stories, and connecting with those patients simply by searching through the stories, as David said, hundreds and hundreds of stories of people. And for me, that was the most important part. I want to connect with somebody who's got stage 4, who might be a runner, and I go into the search engine and search for those people, and then I can read their stories and maybe connect with them even further. I said before, it's an invaluable tool. I think it's actually now a very trusted tool by everybody who has used the service. Only yesterday, I had a telephone call from somebody who said, one of my friends has just been diagnosed with prostate cancer and basically just doesn't know where to turn for information. And the first thing I did was say, yes, please get the guy to call me. By all means, I'm happy to talk to him, no problem at all. And the guy telephoned me, and we talked for about half an hour or so about what he was going through. And the first thing I did was to refer him to the Infopool, because he was about to start radiotherapy. Nobody had really explained to him what the pros and cons of that were. And I said, if you go to the Infopool, not only can you read about radiotherapy and all the side effects that might flow from it, but you can also read the stories of other men who've already been through radiotherapy. So the Infopool, for me, is a brilliant source of information about treatment, diagnosis, connecting with men. And I think it's just, for me, the most important part of it is the ability to connect with others who are going through the same cancer journeys as you are. And so I highly commend the Infopool to everybody. Thanks, David.
Thank you so much, Tony. That was really just wonderful to hear from you. So, conscious of time, and I want to make sure we have time for questions, which we did say. I've only got a little bit more to go, just a couple more minutes. So I just wanted to tell you really about the work that we are doing now, 2024 and beyond, and some of our plans. So really, kind of when we think about the kind of outreach work we're doing, we kind of bracket it into two kind of camps: patients and partners, and then also hospitals and healthcare professionals. So in terms of the work that we're doing to reach more patient partners, that's continuing to host these workshops and attend support groups across the UK, talking to people affected by this disease and telling them about the Infopool. We also advertise on Facebook and well, it's Meta now. I should use its proper term, but most people still know it's Facebook, and Google as well. So when someone goes in and is typing prostate cancer diagnosis, prostate cancer treatment, the Infopool is going to sort of show up for them, getting that so that when they're looking for information, the right information is there for them. We're also going to continue to work on developing partnerships with the likes of Tackle Prostate Cancer, Orchid. We work with PC UK as well. We work with organizations across the ecosystem, but we want to branch out of that as well. So what other organizations can we work with to reach men and their partners where they're at, make sure that they're aware of this at the time of need. And also more stories. And you might say, well, you've got close to 900 stories, David. Why do you need more stories? That's because we talked about there's so many different types of treatments, prostate cancer, and people have different experiences. And there are still lots of really gaps in there. We need more stories for people who've had active surveillance and radium-223 and olaparib and other treatments, some of the newer treatments coming through. And we just want to make sure, that these stories remain up to date and valid. So we continue to work on that, and that takes, the support of a team, one of our nurses who conducts those interviews when we're doing video interviews for those stories and helps to keep the site really relevant and useful. And then, of course, there's hospitals and healthcare professionals and the work that we're doing to reach them as well. So thinking about the medical conferences we're attending, like I mentioned, just had a team up at the Bound conference in Liverpool talking to nurses and healthcare professionals about the infopool to make sure that they go back to their hospitals and they have the resources and support they need to reach patients at the right time. Sending those signposting materials and packs out, those posters, flyers, and business cards, they cost money. We have to get those printed and shipped out, and so it's that sort of support that just is really invaluable. And then our Treating Prostate Cancer Q&A booklet, we've just revamped that, and we just launched that, actually a new version of that, and we see this really now as a kind of non-digital guide and accompaniment to the infopool. So we know there are still some people out there who don't feel so comfortable using digital platforms, and so we want to make sure that there is something else, utilizing some of the information, learnings from patients and putting that into a sort of non-digital format, but also closely tied into all the different aspects and the different tools in the infopool. So someone could, maybe if they're sitting there with a family member who is a bit better on, using digital technology, could just kind of scan a QR code or go in and take them to the right page. So it's trying to make it easier for people to navigate the site as well. And so finally, really the important, how can you help? For us, we were very fortunate to be part of the Big Give Appeal. And so we're asking, if you're able to donate to our Big Give Appeal between the 28th of November and the 5th of December. So during that 1 week only, all donations that we receive will be doubled up to the value of £40,000, thanks to the Big Give for our matched funder. And all funds raised in this will go directly to supporting the infopool and helping us reach more people with prostate cancer. We don't receive the full match giving pot unless we reach our 40,000 target. And so your help in donating and spreading the word about this will really, really help us. And so the links to the campaign page will be in the chat, and we'll also be sending up in the follow-up email as well. So just a huge thank you for those of you who are able to support with that. But there are also other ways of supporting as well. You can tell your healthcare team about the infopool. So we have what we call our volunteer ambassador scheme. If you're willing to talk to your healthcare team, say, hey, have you heard about this new site called the infopool? If you'd like to do that, we can post you a flyer in the mail that you can then hand them at your next visit, which has all the information they'll need. And this is going to help us reach every single hospital in the UK. I mentioned we're about a little over 40%, but we want to be at 100%. That's our aspiration. And so your help will help us get there a little bit faster. See, you guys all have local organizations that you're probably involved with in your local areas. They might be able to partner with us. So are you a part of a Rotary Club, a men's shed, a union, a retirement association? If you think that the benefit from having information about the infopool there, get in touch. We'll send information on how to do all this in the follow-up email, but we'll include an email address where you can connect with us if you have a local organization you think would benefit to partner with. Post about the infopool on your social media. Help us spread the word to your networks that this is a resource that's there for people affected by prostate cancer. Share your feedback with us about the site. We want to know how we can make it better. If you have ideas, there's things that you think we can do better, please tell us, because we want to continue to make this as useful a tool for you as possible. And finally, the last thing is, if you haven't shared your story on the infopool already, go do that. I would really encourage you, go share your story on the infopool and and share your invaluable knowledge and experience. So now it's just time for questions. So I'm now going to swivel across to this screen here. I'm not ignoring you, it's just where the Q&A box is. And we will try and answer some of these questions. So with a first question I see comes from Mike saying, is this expected to replace contact with a clinical nurse specialist? I'd say no, absolutely not. This is supposed to be a resource to support you. Unfortunately, in an ideal world, we would have much more time with the healthcare professionals than we do. We hope you have a clinical nurse specialist, although we know not everyone does. But there are resources. If you don't have clinical nurse specialists, PCUK have a great nursing helpline where you can talk to healthcare professionals. But this is something that you can, maybe you've been told your diagnosis, and your clinical nurse specialist has told you about your different treatment options. The expectation is you're going to go away and think about that. You're going to then come back and make a decision with your healthcare team about what treatment's right for you. But how do you do that? Where do you find that information? Where are the trusted resources? Where are you to find those other experiences from patients? So this is there to really complement this journey, to make sure that you have information in different manners, in different ways, that's going to help you when you do have to make a decision about your treatment, hopefully feel more like you're making the right one for you, and don't then feel like you're going to regret that treatment later on down the line because you didn't know what might have been in store. There's actually a study that was done to 2022 last year that said men were 5 times more likely to experience treatment regret if there was a mismatch between their expectations of what the sort of potential side effects might be and the reality. And so what this is doing is we want to help reduce that treatment regret, because we know people, that has a huge impact on people's quality of life. And we hope this will help you make more informed decisions about your treatment and care.
David, could I just add there that actually the ability to compare the notes of the journeys of other people who are going to go through those treatment options, who've already made that decision, I think is really invaluable. It adds so much more that you can't just get from a clinical nurse specialist. They are amazing, but I think the ability to share the journeys of other people is really important.
No, thank you, Tony. I really appreciate that. We've got a question about androgen deprivation treatment, and is it covered with its wide range of medications and possible side effects? Yes, absolutely. We cover all the different types of treatment on the infopool, and that is covered there with different information, the different side effects, links out to different patient information leaflets about specific different drugs. So that's there. What we try to is also simplify things as well, because we know there are a variety of drugs, and often those are going to depend on what's available, what's licensed, and what's the recommendation of your healthcare professional. So you'll find stories and experiences from people who've had a variety of different treatments on different types of medications on ADT. We have a question here, which I will come to. It says, from John, I assume you can add to your story as it unfolds if you choose to share. Yes, absolutely. So the only thing you will ever have to create an account on the infopool for is to share your story. And that's everything else is not, it's not hidden behind an account. We want that information to be totally out there. The only reason we ask you to create an account to share your story is just so that if there is a need to kind of contact you, or if there's something there that we need to, it helps. And again, you don't need to, your story can be behind a pseudonym. You don't have to use your name, or you don't have to go do it publicly. You can be anonymously, but you can come back and add to that. And that's also a reason to have the account. Maybe you have radiotherapy and want to share your experience, but then unfortunately perhaps it doesn't work, or only sort of deals with prostate cancer for some time, and then you have chemotherapy later, for example, and you can come back and share your experience with chemotherapy a year later or whatever. So the idea is you can come back and share your experience at a later date as well, and continue to add to that. We have a question. I'm just scanning it quickly. So there's a question around active surveillance, and asking, whether or not to be treated or carry on without being treated. Yeah, I want for that. truthfully, what I would recommend there is to go check out the stories from people who've been on active surveillance. You know, hear what it's like for them to be on active surveillance, to monitor your prostate cancer instead of perhaps having what we call radical treatment. And, you know, I think that's really important, because it's only then you can get a sense of what's it like to kind of go back, you know, every 6 months or 12 months and have certain tests. What's the mental impact that might be, you know, and then use that to help drive forwards, you know, the decision as to, you know, balance that up for you. You know, can you live with that, or do you want to, you know, try to sort of remove it straight away? And I think that's, you know, use those stories and experiences and learn more about what active surveillance is like. There are some really great videos and animations that hopefully help it deal with making that decision. So there's a question from Keith: is there much feedback from people who've undertaken a HIFU procedure? Yes, so we have a section on focal therapy on there as well. So if you go to the treatment page, it's in the comparison tool, and then there's also in the patient stories section, there's focal therapy, which is covered and has a mix of people who've had HIFU, cryotherapy, and NanoKnife as well. So those experiences are in there. So I've been from Ian. I've been waiting for radical prostatectomy since May and still have no date yet. Is this normal for surgery yet? Yeah, I mean, you can unfortunately see from Tony's face, I think it largely depends on which part of the country you live in. It's not, it does seem like a very long time. I would recommend, if you haven't already, call the PCUK nursing team and ask them, and they might be able to give you some more information and guidance on your specific issue, Ian. And, you know, if you are waiting too long, you know, what other options might there be for you? You know, can they refer you elsewhere, or what those options are? So I'd recommend you sort of, you know, get in touch with someone. Paul says, could there be a new drug section, detailed progress with NICE, for example, lutetium-177, for instance? That's a great idea. I'll definitely take that back to the team. Thank you for that. That's a great suggestion, and I'll discuss that with the team. I think John says, does the infopool discuss castrate resistance? So yeah, absolutely. So in the kind of guided tool, we talk about what happens when hormone therapy stops working, and what might happen next. And so there's this within the treatment, understanding your treatment choices. It talks about what happens when you, unfortunately, for most people, when the hormone therapy stops working, what your options might look like, and then helps you hopefully to decide which route you might want to go down. And so yeah, that information is in there. So I think that's, looking through that, I think I've covered all the questions, and I think we have 1 minute left before our allotted 45 minutes that we were aiming for. I guess I just want to, you know, thank you, Tony, for joining us today, and thank all of you for dialing in and hearing more about the infopool. And I hope this. We suddenly did have some more questions came in. Sorry that I missed these. I've very quickly see some very nice comments about colleague Harriet, who attended a local support group. Yeah, so I guess that would be another thing. Like if you're in a local support group and you want someone to come from PCI to come talk to you about the infopool, my colleague Harriet does those, and someone very nice comment about the support group in Norfolk. We have a question from Rob saying, can we explain briefly how the infopool will link with the new patient platform? Given the time, Rob, I will hold that question, but we are going to do a webinar, a few webinars in the early new year talking about our new patient platform initiative. So I'm sorry I'm not going to do that today, but we're going to be doing a load of webinars on that and explaining that, and we will definitely be inviting all of you to that as well. And there's a question from Mike, does this include related treatments unavailable on the NHS, such as rectal shield insertion? At the moment, no, it doesn't at the moment. It just covers treatments that are available on the NHS, but it's something also that we can consider, and made a note of that, and we'll look at what other information we can put on there as this site continues to grow. Okay, and there was also a note from Pete saying he did a video in March about active surveillance, but it's not on the infopool. I will check with Harriet on that, because if it's not, it should be, and I apologize to Peter for that. if that slipped through the gaps, but we'll make sure that gets on there as soon as possible. Thank you, everyone, again, and just, we'll be sharing a follow-up email with all those different ways that you can help. And again, just thank you for all of your support, and have a wonderful rest of your day. Thanks, everyone.
David.
Thanks. Cheers. Bye-bye.